Okay, I am here with two of my colleagues. I have Miss Juanita and Miss Janae,
Hey.
and we're going to talk about what public health is. Public health is the promotion and prevention and protection of the public health. Let me start over. Let me cut that. My
Mm-hmm.
edit. I'm just not edit for me.
Okay.
Public health is the promotion, prevention, and protection of the public of the health of the public. It's preventing diseases, prolonging the quality of life, and promoting the health through organized community efforts. There are five social determinants of health. Those determinants are economic stability, education and the quality of access to that quality education, healthcare and access and quality of that, your neighborhoods and the environments that are built around you that you live in every day, and there are social community content to the public health determinants as well. So the first question I'm going to ask is how much education a person obtains and the quality of that education. What do you guys think that plays into the health of a person? The quality of their education.
I'm not really sure. I mean, I guess it depends on how you look at it. I feel like if you are dedicated enough to educate yourself and further your education, then you're smart enough to get your health seen about. Go to the doctor, get health insurance, or get out there and do something proactive for your health. What do you think?
I completely agree. I feel
Agree.
like especially like even if we go back to elementary, high school, when they get health in the classrooms, that at least starts to oh, well, they told us about blood pressure. They didn't told us about our sexual health. They didn't told us about not to be too fat. Like, so it starts then. But I kind of also agree, like, if you don't have a lot of education, you don't take care of your health, and you don't know what's right, what's wrong. You don't look into finding doctors. You don't look into insurance. You just go on about your way.
And you just don't like, I don't know, I guess depending on your, you said income versus
I was
education.
just talking about education. I haven't
Okay.
got the income yet.
Okay, because I mean, I just feel like if you don't like, if you don't know, you know what I'm saying? Like,
Yes, you feel
depending
like if you're
on
less educated, you don't know as much
Mm-hmm.
to get out there and take care of yourself.
or I mean, I wouldn't necessarily say because you're less educated. It's just that depending on where you live, you don't know what's available, and
Right.
you don't. Some people don't know to ask or are afraid to ask. You know what I'm saying?
Right.
So I guess I don't know. I guess it's with that question. It's a lot of different ways you could see it.
Yeah.
Yeah.
So,
That goes to show that the determinants play into each other. Education. When you're talking about education, you're also looking at where someone lives. Because if they don't have the education, they're likely to live
In the hood.
The hood, the
And ain't
ghetto.
nobody trying to walk to the doctor in the hood. I don't want to walk to the doctor and I'm worried about getting shot
Right.
or getting robbed or none of that stupid stuff, and I'm just trying to walk to the doctor.
and depending
Right.
on your insurance, like where you have to go to the doctor, like not even necessarily the neighborhood.
quality
Like the doctor might have
healthcare.
like 2 stars, or the doctor might have like 1,000 patients. So you're just another number. Like you're not really getting the
You're not getting the
healthcare.
quality healthcare that you versus someone who's college educated with a bachelor's or higher.
And can afford
and
good
can afford
insurance
good
versus
insurance.
Care Source or
Right.
Medicaid. And then they don't even cover everything, so your options be limited with that too. Like you can't
Yeah,
ask somebody
like-
to choose between, like me. Do I want to pay for these health shakes and health bars and supplements, or do I want to pay my rent? Do I want to get my health together, or do I want to pay my car note? Like,
Right.
but if I had more education, I would have more money, and I wouldn't have to choose. I would have better insurance, do a better job because I'm, highly educated. So I got all these different degrees. So I'm working at, somebody's, I don't know, CEO
Well,
type of,
I
real
guess
company. And
It's a
Right.
catch-22 because I know college professors who can't afford housing. You know what I'm saying?
Right.
So I mean, it's just so like many different factors into healthcare and all that stuff because I personally had a college professor who was living out of their car when I was in undergrad. Yeah. So and it's like, okay, but you got this degree.
Right.
You're
You
a
got all
smart
this
person,
education.
and
So
why?
what other determinant fell out? Where's the income to
Right.
go with the education? Again, that's one how they. I'm gonna edit that out. We ain't gonna ask if they was on drugs. I'm gonna edit that part out.
well, you gotta edit that out. That's a legitimate question.
I'm just saying.
That's a
I would hope not
your,
with the
your
education.
professor wants this raw, right? It's
Right.
real.
It's real.
It's real.
It's real.
It's real. Let her get the real, because it's real life stuff. Like,
Yeah.
could that be the reason?
Right.
I mean,
Right.
I gambling habit.
Yeah.
They
Yep.
shop too much. Are you trying to keep up with the Joneses and you a Smith? Like,
But if you
And that falls into social and community content. Maybe that's where he's exposed to in his community. Like maybe he lives somewhere where there's drug dealers and drug addicts, or
and he chooses
he's
to
close
go
to a
right on
casino or
in.
something, so he goes right across
he's
the street to
triggered,
the
something
casino
triggers him.
to gamble.
Yeah.
So that shows again how all the social determinants kind of play into each other, whether it's education and the quality of healthcare or economic stability and not being able to afford to take care of yourself like you should.
And
Yeah,
I'll be honest in saying I
afford
didn't
your
know all the
meds, that would
circumstances
change.
surrounding. That's what they told us, that they live in. I don't know if they had kids, a spouse, or what, but that's what our professor told us. And I'm like, wow, like you like did it. Like you went to college, you're accomplished. Why are you living in your car? Why are
right.
you getting government assistance? Like what, you know?
Right.
And how are you getting government assistance? You're living in your car. Like I don't know. It really, like, for me, it opened up my eyes, because I'm thinking like this is just like a poor people thing. Like we grew up poor.
Right.
Like we had the care sources. I don't know
The
if it was
wig
care source back
boxes.
then, but yeah, the crates. They used to come to the house, like the milk
The King vitamin.
and you know,
Right.
like they would have people like in the schools, like, oh yeah, we're gonna come and do dental this, and I'm like, do they do this everywhere? You
They
know?
know, right? Because
And, like,
they don't have
should, though.
access. Though.
They should do it everywhere though.
But they don't need to, because you got neighborhoods like the rich neighborhoods where everybody goes out to, has all the access to get all
That
the
don't
good
mean they're
care and
taking their
stuff.
kids though.
I would hope so.
That don't mean they're taking them.
Right.
They should.
Right. They should.
I mean, but if you think about even like the healthcare, like with the elderly, yeah, they might have at some point worked. They might have at some point had a degree, but now they're old. They're on Medicaid and Medicare, and so the same pot that everybody that's, I guess, below
so now
poverty.
they're back down to the
you
income
know,
stability. They don't
so-
have the income anymore.
I really can't say that the education makes a difference.
With say I live in Everly Village. I work Monday through Friday, 9 to 5. I have a job where I can't leave early, I can't leave late. When am I gonna take my kid to the doctor? Versus y'all coming to the school, and I know my baby's getting her checkups. I know she's getting her vision screening and her hearing checked and the dentist, because y'all coming to the school. It shouldn't be just for poor people. Like realistically, a lot of people don't have time.
Well, some districts, depending on the school district that you're in, they don't have the funding for it.
Right.
Like, or the manpower. Because I remember they used to, when I was a kid, they did your vision and hearing and all of that in school. And we got a grant, I believe they said. I was in like 3rd grade, and they actually came to the school. The dentist, it was dental students, and actually under a general like licensed dentist, and they did sealants or whatever it was. Basically, they applied the stuff to the teeth so that prevent cavities.
Right.
And my mom was like,
I had that done
y'all
as
get
well.
signed
Yeah.
up. Like
I remember that too.
Yeah.
we in the doggone cafeteria, and they got like, they
The
got
little booth on the side. Yep.
and I'm like, wow, like, and I'm thinking, yeah, definitely need this because I love candy, as a kid.
Right.
So thank God that saved us from a lot of cavities. But I mean, basically, maybe somebody saw a need for that in the community. So in a sense, yes, education plays a role in it, but also it's so many other variants,
Yeah. And I think that is where we'll end, because we are almost at 9 minutes, and it was only supposed to be 3.
Okay.
Thank you, Janae. And Juanita had a call, so she had to go. So thank you.
You're welcome.